Hey, are you asking your doctor yet for evidence whenever they prescribe a medication that you're going to go on for the rest of your life, or they recommend a surgeon who might remove an organ? If the answer is no, then you need to watch this case report of a real patient who actually used evidence to make an informed decision.
This is Mike. Mike got diagnosed with localized low-intermediate risk prostate cancer. Mike's primary care doctor referred him to a surgeon who recommended a radical prostatectomy, the removal of the prostate gland. Before making any decisions, Mike decided to get a few more opinions from other prostate cancer specialists. One radiation expert recommended radiation. Another doctor recommended active surveillance, which means doing nothing unless follow-up tests reveal that the cancer has become more aggressive or is progressing. All of the doctors defended their recommendations with statements such as, surgery has the highest survival rates, or active surveillance has been shown to have survival rates similar to surgery or radiation, or radiation has similar survival rates as surgery but less side effects. Mike decided to ask each doctor for their own survival and outcome data. What percentage of your patients died of prostate cancer with at least 10 years of follow-up? None of the doctors were able to reproduce an evidence report that summarized all of the relevant evidence on the treatment of prostate cancer in patients just like him. So Mike went online and visited many cancer sites such as the American Cancer Society, the Milk and Prostate Cancer Foundation, and many others. But much like WebMD, there was very little evidence or outcome data from real trials. And also, there was no evidence on surgery centers or specific surgeons. All the websites had opinions and recommendations and a few tidbits of data, but not one site summarized all of the available evidence for patients or doctors. The key question for Mike was, does surgery have much better survival rates than active surveillance with low-risk localized prostate cancer? Finally, Mike called Dr. Evidence, who helped him do an evidence project to find and aggregate outcome data on this question. Thankfully, they were able to bring in survival and mortality data from over 10 studies. Here are some of the highlights of the evidence that were on patients similar to Mike that had surgery or active surveillance. At an average of 15 years of follow-up, 15% of 810 patients who underwent surgery had died of prostate cancer, versus 34% of the 814 who underwent surveillance, for a difference of 19%. At an average of 13 years, 18% of 157 patients who had surgery died of prostate cancer, versus 29% of the 166 patients who underwent surveillance, for a difference of 11%. At an average follow-up of 10 years, 5% of 122 patients who had surgery died of prostate cancer, versus 9% of the 131 who underwent surveillance died of prostate cancer, for a difference of 4%. Only 2 out of 1,300 patients who had undergone active surveillance had died at 15 years of follow-up. 993 patients underwent active surveillance, and it was estimated that only 6% of the patients had died of prostate cancer at 15 years of follow-up.
Any risk of incontinence or impotency after surgery was higher than I could tolerate, but I found that there were survival benefits with surgery versus active surveillance, which can range from 2 to 20% depending on when and where the study was done. But the dilemma of surgery is that there is still a real possibility of dying of prostate cancer, which can range from 1 to almost 20% depending on the surgeon, the type of cancer, and other factors. The evidence was definitely not black and white, but based on the evidence, my personal preferences, and a review of the outcome data with my personal physician, I chose active surveillance, given the survival benefit of surgery was not big enough to convince me to take a chance on incontinence or impotency.
That is a classic scenario. A patient gets diagnosed with the disease, goes and sees a bunch of specialists, and they give conflicting opinions and recommendations. And then the same patient goes online and gets the same conflicting opinions and recommendations. Getting all the relevant evidence from those doctors is not going to happen. Getting all the evidence online is not going to happen. But one thing will never change. The ideal recipe for healthcare is getting the evidence, reviewing that evidence with your doctor, plus your personal preferences, and then choosing the right therapy.